My name is Harry Hawkheiser. I'm the director of the MIDAS Center. I'm happy to be your host here. And it's also my pleasure to welcome Pedro Nascimento de Lima to give a talk to us today. Pedro is an associate engineer at RAND and a professor at the Pardee RAND Graduate School. Some folks may remember he gave a talk a little while back about uncertainty, which was really quite interesting. But his research covers a broad variety of areas all around the notion of using computational models to inform complex policy decisions involving uncertainty. And he's applied this to pandemic response, optimization of cancer screening recommendations, and policies to address racial wealth disparities in the US. I got to say, I'm going to tease just a little bit here. That Pedro is the membership chair of the Society for Decision-Making Under Deep Uncertainty. And I really just have to wonder what the meetings of a group like that would be like. So with that, I will hand it off to Pedro, who's going to tell us about value of environmental surveillance for a pandemic response.
Yeah, thanks, Harry. I'm always happy to talk to the audience. I'm very appreciative of all the efforts that infectious modelers have done during the pandemic, before and after. So it's always nice. And if you are interested and curious about decision making under deep uncertainty, like Harry mentioned, I will also make a plug here that there is also a special interest group on decision-making under deep uncertainty in health applications. I'm chairing that group, and there's a lot of interesting work in that area. And so we have a talk next week, actually, about, in 2 weeks, about antimicrobial resistance and deep uncertainty. So I feel like that will be interesting to some of you. If you're interested, you can reach out, and I can connect you with that group. Okay, so now today, I want to present this paper that we released as a working paper at the RAND website. Over here, we have a link. If you cannot find the paper, you can just shoot me an email. I can direct you to the right place. And the paper is about the value of environmental surveillance for pandemic response. And this is the list of authors. There are many contributions from different people at RAND. I also see people like Laura in the meeting as well. And so I'm very happy to present on behalf of this group. So just going through the agenda quickly, I will give you a very, very quick background about environmental sampling surveillance and why, in principle, that it's a useful set of technologies that we have at our disposal now. And then I will dive into the policy question that we address in this paper. I'll give you an overview of the methods. I will go through results, conclusions, future work, and you feel free to interrupt me or send questions in the chat, and then I will address them if I can, keep track of those messages. If not, we can discuss at the end. Okay, so environmental sampling surveillance really went mainstream during the pandemic, the COVID-19 pandemic, I would argue. Environmental sampling surveillance via wastewater became widespread during the pandemic. The CDC launched the National Wastewater Surveillance System. We have a lot more interest in sampling from the environment versus sampling from people these days. And that's, of course, beneficial for several reasons. One of them is that we don't need to rely on people wanting to get tested. We can get signals from the disease just from the environment. And so that's really promising development. There are many benefits that there are papers that were written describing, including we get early warning, we don't rely on people wanting to get tested, we can track different variant strains, and we have probably better coverage because, again, people are not having to get tested for us to see that signal. So everything it looks great in this field, and I think everyone is excited about having another source of data to potentially calibrate our models to and use to inform decisions. But I would say that progress cannot be taken for granted, and especially in these times where surveillance efforts are being scaled down, and we are seeing COVID-19 surveillance efforts being scaled back. There's not a clear and stable long-term funding mechanism to support environmental sampling necessarily everywhere. We see environmental sampling surveillance mostly on highly resourced jurisdictions, and so coverage is not equitably distributed in the population. And so it's not clear that we have the same level of data evidence as we've had over the past few years. And so the purpose of this paper is to define an approach to quantify the value of environmental surveillance. And by value, I mean the dollar value, the monetary value of environmental sampling surveillance, and having this stream of data in addition to syndromic surveillance data that we've had traditionally. And we would do that using the first year of the COVID-19 pandemic as an example. And the idea is that to estimate this value, had we had this stream of data coming, would we have made better decisions then? And so that's kind of the underlying question. There are also other questions, I should say, and there are also other sources of value and mechanisms through which environmental sampling surveillance generates value that we will not focus here, right? So the CDC now is using environmental sampling surveillance, wastewater surveillance to project hospitalizations, and that's great. There's also other uses of environmental sampling surveillance. Here, we'll really focus on quantifying that value in a new pandemic that looks like COVID-19, and other extensions will build from that. Okay, so to make it clear how we think about value of environmental sampling surveillance, I think it's useful to just go into the model and how we calculate that. And so in this paper, we have this idea that there is a total pandemic cost that we can compute for a new pandemic, right? So let's say for COVID-19, in the first year of the pandemic, there's a total cost of that event, right? The big component of that cost are the health costs. And so these health costs, they include costs of people dying from the disease. They include the costs of people getting the disease but not necessarily dying because they have to be out of work, and so on and so forth. So there's the first primary effect of the pandemic, which is just the health. There's also costs with non-pharmaceutical interventions. And I think many of you in this meeting probably spent a lot of your time of your life modeling this, and you realize that non-pharmaceutical interventions have a cost, and it's actually very hard to measure that completely and well, but we cannot ignore those costs, right? And there's also the cost of surveillance. So the idea is that environmental sampling surveillance will affect health costs. Hopefully will decrease health costs by enabling more targeted public health interventions, right? So if we have better data, if we have earlier data specifically, in principle, we can have more targeted interventions earlier, and they will be more effective. But also, environmental sampling surveillance could increase the cost of NPIs. Even marginally, they could do that. Why? Because if we act earlier to reduce transmission, for example, that will have a cost that will probably be higher than waiting to act. It isn't clear exactly what is the order of magnitude of the increase, and so that's one of the questions we try to answer with this paper. And there's also the cost of surveillance, right, itself. And so when we're thinking about environmental sampling surveillance and how it changes these kind of components of the cost of the pandemic, we're thinking about how it changes it marginally from a baseline scenario where you have syndromic surveillance, just case data, as we had during the COVID-19 pandemic. So if you can compute these three components, then you can say that the value of surveillance is the difference between the pandemic cost without environmental sampling surveillance and the pandemic cost with environmental sampling surveillance, right? So if this value is positive, then having a pandemic without environmental sampling surveillance will be more costly. And the order of magnitude gives you the value of surveillance. If you set this cost of surveillance to 0, and you do this difference, then this number is the maximum amount you should be willing to pay to have an environmental sampling surveillance with characteristics that you use to compute this total pandemic cost. And so that's the main kind of initial framing that we adopt in this paper. Again, we don't make statements or claims about what other effects that environmental sampling surveillance can have, and other mechanisms through which it can generate value, but this is the thing that we are focusing on. Okay, so if you may or may not agree with this framing, but if you take this as given, then we have to think about how we actually compute those components, right? And here in this paper, we will say that there are 4 ingredients that we will need to think about if we want to answer this question. So let me admit this person. Yeah, so there's 4 ingredients, and you can't really make a case for the value of environmental surveillance if you don't think about the 4 ingredients. The first one is the disease transmission model. And I think you are very familiar with this. I will not spend too much time discussing that. You can find that in our paper, but that component tells how the disease spreads. Beyond that point, you need a model to describe the surveillance system, right? It can be a simple model, it can be complicated, but you need to tell how the environmental surveillance system changes how we observe the disease. So I think about this as a latent process that you don't observe, and then there is another system that observes that system. And the idea is that if you change this, you won't change the disease transmission immediately unless we explain how the surveillance system changes our policy. So the NPI policy model is a method that describes how we react to the data that we have available. And so one of the assumptions that are baked in this analysis is that if you change how we're observing the system, then your policy will work a little bit better. The NPI policy model, and then given an NPI effectiveness number, that would change disease transmission. And so that will kind of create this feedback loop where if you change the surveillance system, you have slightly different policies, and these policies will affect the disease transmission. So in this paper, I will talk about those assumptions a little bit later, but let's just complete the picture. Okay, so we have these 3 components. What else do we need? So the disease transmission model would generate health outcomes. Again, these include number of people who die with the disease, number of people who get the disease, and the cost of those 2 sets of outcomes. But we also have to consider economic outcomes, including the cost of the NPIs. If you put those two together, then you have an evaluation model telling me how much you value health versus these economic outcomes. Then you can complete the picture and look at the value of surveillance. Now, I'll just give you a relatively brief explanation of each of the components. And if you want to dive deeper into any of them, you can go and look at our paper. It should be fairly simple to look at them. So the disease transmission model here will be a metapopulation stochastic SCRI model with 6 jurisdictions. We chose parameters to reflect wild type SARS-CoV-2. So we're trying to simulate the first year of the COVID-19 pandemic. And that's our base case. Just as an information to some of you, we implemented this model with Odin, the ODIN-R package, which we found very helpful to simulate the model stochastically. And so that was really nice. And that's all I will say about the model. You can get more information about the model in our paper. And so let me go to the other parts. Now, Our goal here was to develop the model that was the most parsimonious model that could answer the question, because we wanted to simulate different kinds of diseases and different kinds of scenarios. So everything else, we strive to develop the most parsimonious representation of that component that we could think of. Also because we wanted to simulate different kinds of environmental sampling surveillance. So we have wastewater, there's also people developing air sensors. So we didn't want to model the surveillance system in such a detail that would make the paper restricted to one kind of environmental surveillance. With that out of the way, I will just go through the other components. So for the surveillance system, the most parsimonious representation of surveillance that you can really think about is to imagine that there's a binomial process drawing, making binomial draws from the number of people who are leaving the susceptible state, right? So people getting infected, but that process happens with a lag. So we're not observing, so today at time t, we're not observing people who got infected today, of course. We are observing that process with a lag. This Li is the number of days that the surveillance system takes to detect people who actually got infected from the time of infection. So a key claim that wastewater surveillance researchers have made and shown in research is that they can reduce that lag from about 30 days, based on the research that we looked at, to around 7 or 6 days. So there is about a 5-day lead time between wastewater data and case data. Of course, that varies because that depends on how fast people process the samples and so on and so forth. But they've been able to demonstrate pretty consistently that there is a meaningful lead time. And so that difference, that Li for the surveillance system, will drive a lot of the results here. There's also another parameter, which is the Pi, which is the case ascertainment rate. How many of those cases, what proportion of those cases can you detect? And of course, syndromic surveillance depends on people wanting to get tested and seeking testing. There's also another issue, which is that for a syndromic surveillance system, this Pi is really time varying. And a lot of people, estimated that, and this thing really is all over the place during the pandemic. But for environmental sampling surveillance, this Pi is higher. And so if you cover all the population, you're seeing, essentially data from all the population that is covered by the, wastewater system. And so this is really, we couldn't think about it something that capture the crux of the problem in a more parsimonious way than this. I've seen models that model the, shedding dynamics and so on and so forth. It's not clear to me that matters as much, and that is much different than this. And so this was kind of the most general formulation that we thought that was also the most parsimonious. Okay, now this is the equation that describes the surveillance system. One thing to note is that in the system, there's multiple jurisdictions. So they can have, in principle, they can have multiple surveillance systems. So it could have, let's say, one jurisdiction with wastewater surveillance and others without. That's already kind of implemented in the model. In the analysis that we are going to do, that I'm going to show you now, we only simulate all jurisdictions having the system at the same time. But you can see that you could have jurisdictions with different lags, and that could be represented here as well. Now, that data, so this becomes a time series of estimated case incidence, and that is used in a policy to introduce interventions. And the way we modeled this was relatively simple and aimed to capture how jurisdictions introduce those reopening plans during the pandemic. So if you think back in the pandemic, you can imagine, you can remember those plans with green disease levels, yellow, red, and so on, purple. And as we entered those levels, different interventions would apply. that's what this equation is doing. So this XIT is the target intervention level. So if this is 0, we're not doing anything. We're not introducing any interventions. If this is X max, then we are introducing the highest intervention level, which in the case of this paper is 5. And if you are anywhere in between, you will have different interventions being applied. And so depending on this level and this NPI effectiveness, that will change the disease transmission equation. Which is one thing that is important to note is that the CIT is that case incidence measure that is being used to drive the policy. And so depending on the surveillance system, if this is very lagged, then the policy will kind of react slowly and to old data, right? And if the surveillance system is pretty fast, if this lag is small, you'll be able to react more quickly. So that's how the surveillance data enters the policy. And this equation works such that depending on the disease incidence threshold, you step up intervention levels. There's a little bit more to this way of framing non-pharmaceutical interventions. You can look at the appendix. There's a few more things there you will find, including ways to introduce decision lags, because we cannot assume that decision makers will see data today and they would introduce interventions in the same day and they will have an effect in the same day, right? That's very unreasonable. And so we introduce decision lags in the paper as well. But yeah, that's the kind of the main framework. Other than that, we have to have a way to value these outcomes. So in the side of valuing things, we measure morbidity, which is the cost of illness, and mortality, cost of deaths. We account for those things, for both things as well. So you can see the effect separately. Let's say if we have a disease that is as transmissible and it infects the same amount of people as COVID did, but doesn't kill anyone, right? Would it be valuable to have a system to combat the disease as well? You can see that. You can get the result by looking at, you can get that answer by looking at our results as well. You can also look at economic outcomes, including cost of treatment and also the cost of NPIs. And we approximate the cost of NPIs as a linear function of the intervention level. We make also other approximations. And in general, they are all on the side of underestimating the effect of the system. So I think our values or estimates are really a lower bound to the value of environmental sampling surveillance. Okay, so these are kind of the main components. If we want to make a case and to evaluate the value of environmental sampling surveillance, you really need to look at these 4 things. And if you're interested in kind of using this model, extending, you should be able to find your way in our appendix. Okay, so now let's look at our results. So what do we get from a model when we make these structural assumptions and then evaluate a few scenarios? Okay, so the first question I want to address is just the bottom line question, right? So how valuable would an environmental sampling surveillance system be in the first year of a new pandemic that looks like COVID-19? So I will just give you the table first, just so you get acquainted with the orders of magnitude that we're finding. And so here, I want you to focus on this column first. So this is the base case scenario. This is a scenario where we have non-pharmaceutical interventions being introduced and removed without early warning systems, okay, or environmental sampling surveillance. So calibrating the model, we find this epidemic side, we would infect 29%, about 30% of the population. That would have a cost of illness that would kill a certain amount of people. Per 100,000, around 150 people per 100,000 people. And that would entail a cost of death, also health costs. And so health costs include the cost of death and the cost of illness. So as you can see, the cost of death is really the driving factor here. Cost of illness is also relatively high, but not nearly as much as the cost of deaths. But introducing these interventions would also mean introducing non-pharmaceutical interventions, as we did during the COVID-19 pandemic. in the base case scenario, we would spend most of the year with some NPI level, right? So days of NPI means that XT NPI is greater than 0. And so we would spend 325 days with some NPI, and 113 days at the maximum NPI level, which would look like the most stringent intervention that we had in the US. That would also entail a cost. If you add the total the health costs and the NPI costs, you get the total costs. And so the net monetary benefit is 0 because this is the reference scenario. We also have a scenario where we don't introduce NPIs just for verification purposes, but we don't look at that. But as you can see, having NPIs without the early warning system is a lot better than no NPIs in the base case scenario. And there's a lot of value just doing that. Now, the question that we are trying to answer is, okay, what is the marginal value of the environmental sampling surveillance relative to this scenario where we responded without it? And the base case scenario for that is a case where we have a 5-day early warning relative to the syndromic surveillance system, which is about the lead time that people are reporting when they are doing these studies with wastewater surveillance systems. So if you look at that, we avert about 16.9 deaths or 17 deaths per 100,000 people. And if you also account for the lower cost of illness, that would reduce the total pandemic cost by $1,600 per person. And if you're trying to think, okay, what is that? Like, what is that order of magnitude? Is it, a lot, a little? It's a pretty valuable thing if you think about, sending out a check of $1,600 per person because you made a decision. And so it's pretty valuable in the base case scenario, okay? It reduces that, and it also didn't increase the NPI costs more than it reduces the cost. But as you can see, there are NPI costs that are higher here. Okay, and if you have higher, like a system that doesn't provide the 5-day early warning, maybe only provide a 2-day early warning, we'll also find it still be valuable. And the value increases not linearly. So from 2 to 5, you get about 1,600, and like from 5 to 10 days, you don't get a lot in this analysis. So that's the base case scenario. These are kind of the main variables moving around. Now just explore a little bit more of those results with you. So again, now we're going to just look at these results graphically, and we're going to look at the health costs. And so health costs generally decrease as you have earlier warning, right? And so these are thousands of dollars per person. NPI costs generally increase. And here I have a little issue with my legend, but they generally increase, but not by the same amount, such that your total costs are decreasing and your net monetary benefit is pretty positive. And these are comparing 100,000 stochastic realizations across the two scenarios. And so, okay, so now you might be wondering, okay, in the base case scenario, it sounds like this is valuable, pretty far from 0, I would say. But the question becomes, okay, but how robust is this result, right? So what if the pathogen that we have in the next pandemic is more transmissible or less transmissible than SARS-CoV-2? It's a very fair question because, as we make decisions to maintain those systems, we're not thinking about getting something that is exactly like SARS-CoV-2. It might be a little bit different. Okay, so if it's more or less transmissible, what we find? So now we are comparing the base case scenario, which is a SARS-CoV-2 pandemic that you use, and you're using the system that provides the 5-day early warning. So that's kind of that $1,600 value here. So if you have a new pathogen and you respond exactly in the same way, but with the new that system, the value will be pretty close to 0 if it's half as transmissible as SARS-CoV-2, because it's a slower moving pathogen And so you don't need as much early warning as you would need. But if it's 1.5 times more transmissible, then the value is more than double. And so you can see that this measure of value is quite dependent on the assumptions that you can make and on the transmissibility of the pathogen. However, I also want to point out that in general, if the value of the system is lower, that is a better scenario, right? A lot fewer people are dying with the disease because of that pathogen, at least in the first year of the pandemic. And so the value is lower because the pathogen is not as dangerous. And the value is higher also because it's a pretty grim scenario. So you have to remember that the value being high, it's not a good thing necessarily because it's a worse scenario for pandemic response. Okay, so we look at transmissibility, but you might be going, okay, but how robust is really this result? Because as you can imagine, there are many assumptions that go into this, right? So we could have transmissibility that is different, but we also have mortality that is different. You could also look at our NPI cost assumptions and you might not believe in them. You might say, well, what if NPIs are a lot more costly than you are considering? And also, what if NPIs are not as effective as you are assuming, right? There's also other kinds of parameters that change this equation. One thing is for decision makers to take longer to make decisions, or for policymakers to not be as stringent. So they have the system, but they're not as stringent to introduce interventions. So we look at the set of scenarios kind of varying these parameters. And mostly the environmental sampling net monetary benefit remain positive in a lot of these scenarios. So looking at the base case scenario, and this is the transmissibility scenario that we're looking before. Now we have all these other scenarios with half as deadly pathogen, 1.5 times that deadly pathogen. And most of the time you get a system that has net positive monetary benefit. There are a few things though that happen that are nonlinear, and I just want to let you know that they exist. So you might be looking at this scenario, for example, a scenario where we have 90% of a maximum NPI effectiveness or 50. And I would show you exactly what I mean by that in the next slide. But I will tell you that these two scenarios, they have NPI effectiveness, non-pharmaceutical intervention effectiveness, that are higher and lower than the baseline. And the baseline is here. So you would imagine, well, why the net monetary benefit of the base case scenario is not between these two, right? And that happens because there is some linearity. So a question that we had was, well, what is going on with that parameter? Why does more and less NPI effectiveness imply lower environmental sampling surveillance value? And this is not a trivial result because the results were not linear and non-monotonic with respect to that parameter. So we run a different experimental design where we varied the maximum NPI effectiveness, and that is the effectiveness of the maximum intervention level, which is basically the effectiveness of a lockdown. So if you look at this number here in our dotted line, this is the effectiveness of quote unquote a lockdown in reducing transmission. So we reduced almost 70% of infectious contacts. That's consistent with the literature, and that was also verified in the calibration exercise that we did. Now, that is the base case assumption, right? So when we present our base case scenario, we're presenting like this point in this whole curve. And I will also say that we can also vary the R naught. So we also varied R naught. The base case scenario was 2.5, but it could also have higher R naughts or lower. And so what we find when we did this experimental design is that, as you would expect, the value of environmental sampling surveillance is pretty much zero if non-pharmaceutical interventions are not effective, right? You would expect that. If you have the data, but people don't react to it, or they really don't adhere to interventions at all, then of course the system will not be effective. And it remained pretty close to zero for a large space, in the parameter space, until it starts to reach 50%. And so each intervention level, I told you we have 5 intervention levels. So each intervention level at this point here is reducing about 10% of infectious contacts. And it peaks around here. In the paper, we find that there's a relationship between R naught and this point. But the main message here is that it's not so simple. There's a non-monetary relationship between the maximum NPI effectiveness and the value of the system, but it is positive. The value of the system is positive as long as you have relatively high NPI effectiveness beyond 50% for lockdown, and it remains there mostly. But it also starts to decrease because at that point, your intervention is so effective that the early warning is not pulling a lot of the weight there anymore. Okay, so that's one kind of non-linear result. And it's interesting to find this because everything else in this model is linear. So this is really we think is a property of this problem, really. Okay, so you might also be wondering, and that's the last thing that substantive result that I will give you, is that we don't get a new pandemic like SARS-CoV-2 every year, right? And so the question that you might be asking is, okay, but how likely would a new pandemic like SARS-CoV-2 would have to be so that maintaining a system indefinitely would make sense? Because for that value to be realized, you really need to have the sampling relatively soon once the pandemic starts. And you have to kind of maintain that capacity somehow. So making a few assumptions, you can answer that question. If you make the assumptions that the pandemics are independent, you can calculate how often they would have to happen such that the system has net positive benefit. And it turns out that an ESS system would have net positive value even for rare pandemic events. So now we're showing you the pandemic frequency so that the system has net positive value for different costs. So if it costs $10 per person to maintain the system per year, how often do you have to see a pandemic with these characteristics such that the system has net positive benefit? And let's say in the base case scenario, we're looking at more than 150 years. So if you expect to have a new SARS-CoV-2 like pandemic in the next 100 years, you definitely should have the system operating in expectation of that pandemic, and you have a net positive value for society. Yeah, so there's a final result. And so a few conclusions here that we want to leave is that these systems provide meaningful net benefits under baseline assumptions, and almost all alternative scenarios we explored. Of course, you could imagine combination of scenarios, like what if something is less deadly and less transmissible. But in all these kind of one variable at a time scenarios, they provided net positive benefits. One thing that you find when you do this is that a system like this really helps mitigate the effects of slow or lenient policy decisions. It helps mitigate the effects of pretty dangerous pathogens. And so the worse the scenario, the more valuable the system is. But they also deliver decreasing marginal benefits, right? And you could also, we also find that they can have positive net benefits if permanently maintained. So we hope that conclusions help people make the case for maintaining those systems going forward, but also helping choose which pathogens should be monitored, as well as whether to expand environmental sampling surveillance to other populations that currently are just not covered by those systems. Yeah, so I think I just gave away my next slide. So a few limitations is that this model was purposefully parsimonious. So it's not, it was the first model in this kind of stream of work. So we wanted to do something that is general, and then before we go into very specific applications. And so you would have to do some more tailoring for more specific use cases, like I described. And like I said, we want to, going forward, clarify the value of environmental sampling under alternative time horizons and regimes, because we did this analysis for a pandemic, but a lot of the times these systems are being used for monitor endemic viruses. And there, the accounting can be a little bit different because the way we are reacting to the virus is different. And you could also use the system in an elimination regime. You're trying to eliminate disease, and that's a kind of different problem. You could also look at marginal versus total value. The marginal value is the idea that there is the value of installing the system for everyone in a jurisdiction, but you could also compute the value of expanding the system. And this model can be used for that purpose. And it could also inform more practical decisions like how to respond to a specific pathogen or scenario. Yeah, and so the question that I leave open to the audience is kind of what kind of work would you like to see? And that's kind of a question that I would like to hear more from this audience. I'm very curious about what you think about this. And I should also say that RAND work in these areas is growing. There is an initiative to look at the ethics of environmental sampling surveillance. If you are interested in that, you should talk to Laura Farhady or reach out to me or her. And there's also other proposals in advancing research in those areas. And if you're interested in collaborating, you should reach out to me and we should talk. Okay, so I have a few more takeaways, but with that, I will leave the ground open for questions.
Hello.
Thanks. Great talk, Pedro. Folks, raise your hands, just speak up. Questions in the Q&A. We have one here that I'll just start by reading, and then we'll get to Leah's got a question, but let's start with this. Rebecca Smith says, I recently had a chance to ask a group of local public health officials about the use of wastewater surveillance. They basically said that they like to look at the dashboards, but they don't know how to use them to make decisions. How would you modify the model to support public health decision-making?
Yeah, so that's thank you so much for this question, because that's one of really the motivations for us to put this together. I will just go back to this figure here. And so the way we set up the model, it has kind of a dual use, but for good, right? Not a dual use for bad things, but a dual use for good, in the sense that if you parameterize the model, and if you parameterize the model, let's say for a specific virus, for an endemic disease, the value of surveillance will be positive when the system is used to improve health more than it increases other costs. And so you could parameterize the model in such a way to say, okay, what should this non-pharmaceutical intervention policy be? Like, how exactly should you set these decision thresholds based on wastewater data such that you get positive value, such that you can reduce that more than increase other costs? It does require, though, to kind of work through that with a specific disease and with a specific decision. So you have to start the discussion by asking, okay, what are the decisions you really want to make using that data, or that you imagine you could make using that data? It might not be non-pharmaceutical interventions anymore. It might be, making masks available abundantly at some jurisdictions where you're seeing spikes. It could also be a vaccination campaign, or it could be other things, right? So there's nothing here inherent in this model that prevents you from looking at other kinds of interventions. So again, it takes kind of time and effort to do this analysis, but we think that by doing that, you have a stronger case for using this wastewater surveillance data, and hopefully a better justification for introducing those decisions. Because there will be people that will question, like, why are you introducing these interventions now? And is it valuable to do that? So we think that this kind of framework can answer the whole question of, one, what is the value of the system, but also how you use that to improve health at a reasonable cost and an acceptable cost. So I would love to kind of work on that, and it's hard though, because the answer will not always be that you should use the system, right? At some point, the answer might be, well, you should not introduce that type of intervention because you're not improving health as much as you're increasing other costs. And, that's the kind of conversation that I think we should be having more.
Great.
Yeah, thanks for the question.
Great, thank you. I have a question from Leah, and Leah, I'm going to ask you to unmute, and why don't you ask your question? Hello?
Sorry. My name's Martin Meltzer. I see Leah Bishop forwarded the invitation to me, so I guess that's me.
Yeah. Go ahead.
Sorry, Martin Meltzer from CDC Atlanta. First of all, thank you for the very nice presentation, and the paper I very much like. It's very crisp and focused. I have a comment and a related question. Your table, it's actually, I think, figure 2 in the supplementary figure 2, where you talk about the amount you spend depending upon the likelihood of the frequency. That, in my mind, is essentially what that is an insurance premium. And I can tell you from personal experiences, one of your challenges in public health is selling the premium. Nobody likes to pay insurance premiums. That's the problem. And so it comes down to the question of, so your model is a lot of assumptions, and let me be absolutely clear here. I think you've done a very, very nice job of being very clear about the assumptions. There's no hidden black box of assumptions here, and that's very good. But my question to you is this, and it helps, I think, answer or illustrate to people why they should pay the insurance premium, is this: how much data do we have available that demonstrates that the use of environmental surveillance, particularly wastewater, actually allows a faster notification and response? And of course, as you correctly pointed out, it's not just generating the data, there has to be a response, otherwise it's worth nothing. So how much data do we have? And if we don't have a lot of data, how should we collect it?
Yeah, thanks for the question, Martin. I would not expect to see you here, but I guess it makes total sense that you joined the meeting. Just for context, Martin and I were in a panel at ISPOR, so it's nice kind of to hear from him. So yes, I 100% agree that the empirical base. So if I go back in this, as you could see in the paper, it takes a lot of assumptions to go from just boxes to the value. And I think one of the things that we wanted to do is just work through that to demonstrate all of the assumptions you have to make to get to that conclusion. And I agree with you that the evidence base for some of those links is not super good. I think I've seen some empirical papers looking at people who actually use environmental sampling surveillance to introduce decisions, but there's not a lot of that. It's also the case that it was not even possible, like up until I think very recently, or at least even now, when you look at, let's say, the CDC, wastewater dashboards, they usually use those relative kind of viral concentrations that people really don't understand and they don't know how to act upon. But that, I think, is changing now. Now we're putting together the methods to go from viral loads to prevalence. And there was a paper kind of demonstrating that you can estimate prevalence from wastewater data. There's also, the CDC's work forecasting hospitalizations based on wastewater. So I think the reason why there's not a lot of evidence and data kind of supporting each of those points is that the technology just wasn't there. And, during the COVID, quite frankly, everyone was in kind of, response mode. But I agree with you that we should work on that as well. So one person asked me a question when I present this to a different audience, and the question was, can we, because this in the model this works, in reality for this to work, there are several things that need to be in place, right? And it might be the case that we will not be able to demonstrate that all these links actually work and we have empirical data supporting them. before the new pandemic. So a question was, is there a way to measure maybe the behavioral response to wastewater surveillance risk data that people see? Because if you can demonstrate that people are responding to this even without a policy, right? Let's say they just see the surveillance data and now they have that data and now they are starting to wear masks, for example. And if that is happening, if there's empirical evidence that's happening, then you can say, well, this can happen even without a policymaker telling people what to do. And that would be, kind of a nice empirical result if that was true. So yeah, I agree with you. The empirical evidence base is not super strong. You need to make some assumptions in the way. But I should also say that there is evidence about, for example, the effectiveness of non-pharmaceutical interventions to reduce transmission, right? And that's kind of makes sense mechanistically, and there's also evidence there. So I think I addressed your point. I think I really like your comment about the insurance premium. I do think it is kind of insurance. And I've seen some reports that, some surveillance efforts are kind of going down. And that to me is like, uninstalling your, fire alarm after you have, a fire in your house because you haven't used it for a year or so. Like that's not how you should think about early warning, right? You should think about early warning as something you have to have there. You have to have some capacity to do pretty quickly, even if you're doing sampling at maybe not a super high resolution and very frequently, but at least you have that capacity that can ramp up quickly so that you can have a better response in a new pandemic. So I think it's a really nice frame. Yeah, insurance premium. I think I'll use those terms next time I give this talk.
Well, thank you for your very comprehensive answer. I did enjoy it. Thank you.
Great, thanks. We have a couple other questions in the Q&A. An anonymous participation says, thanks for a great talk. That there was robust analysis. Is there a sensitivity analysis too? You examined transmission as a factor. How about other factors to impact your model? Is 5-day warning practical in reality? The comparison between 5 and 10 days shows nonlinear results. What is that? How does that inform the policy making?
Yeah, okay, so there are a few things there. I think now I figured out how to see the Q&A so I can actually look at the question. So when we did this, like different scenarios, that was kind of a whole set of one-way sensitivity analysis. And in all those scenarios, as you can see, the net monetary benefit was kind of pretty robust and not zero, unless when you have something that is not transmissible. We could also do a more kind of global sensitivity analysis or a robustness analysis, but we felt like at that point, the paper had enough results that wouldn't really add a lot of substantive, useful claims to the paper. But that should not be, hard to do. And so if the reviewers come back and say, hey, you should do a more global sensitivity analysis, we'll be happy to do that as well. I think there are also things, the comparison between 5 and 10 days. So that's a good point. When we do this analysis, you have to make some assumptions about how much early warning the system will give. Looking at the literature, it seemed like 5 days was pretty reasonable and supported by the data. But as you can see, we could do all of this for the 10-day and the 2-day early warning. And as you saw, even in the base case scenario, the net monetary benefit was pretty positive, even for something that only gives 2 days of early warning, which to me was a little bit surprising even. Yeah, so we think that won't change results dramatically if we marginally change the early warning that the system is giving. Yeah, so I think this answers most of the questions. I think there are a few more analyses that we could do, and I think this group is welcome to kind of do that. We have people that took up the paper and replicated it and kind of are working on it as well. So you could be one of those as well. If you want to collaborate with us to do some of the things, you can also reach out. We'd be happy to collaborate on this. Okay, so I'll stop here for that question.
Great, and maybe we can sneak one more quick question in here, which I think may just be a comment as much as a question, but this is from Jibe Wen, who says that, just skimming here, that implementing policy based on wastewater may not be as timely as assumed in the model. And this is coming from a perspective in Alberta, Canada, where preparation may be scheduled 1 to 2 months ahead. And so that a couple of days of wastewater surveillance leading are not substantial benefits.
Right.
If you have
So I
any
think
response
you're kind of alluding to like preparations for a new search. And I think it's a fair point. There are certain decisions that you have to make not just a few days before you have a new surge, but months. And so in this model, we're not looking at these kind of preparation activities or policies that you have that enhance pandemic response, but kind of increase capacity, right? We're not looking at that. That's an interesting question as well. We're only looking at the effect of reducing transmission. And we don't think that anyone introduces interventions to reduce transmission that much earlier, right? It's usually something that people wait to see the data and see, oh, this is really bad. So now I will, ask people to, not go to work from home. So we don't think that those policies happen really that much before. And so, yeah. And if you could demonstrate, for example, I think your point is interesting, because if in addition to the effect through disease transmission, you could see an effect from better preparedness, maybe by buying PPEs or preparing, or just hiring travel nurses. I don't know, expanding the system, the capacity of the system to absorb the shock. That could also be an interesting avenue of value. But as you say, those decisions probably need a larger lead time.
Okay, well, with that, Pedro, I think we're at the top of the hour, so I want to say thanks. Great discussion from everybody. I know I had about 8 or 9 questions I would have been happy to ask if I had the time had been available. But I think folks can get in touch with Pedro if they've got further questions. And thanks everybody for attending. We're going to take a break from our monthly webinar in August for our summer vacation. We'll be back in September. So once again, thanks, Pedro, and we hope to see you all at our next webinar.